When people lose their ability to memorize data, they have amnesia. Amnesia refers to an inability to recall information that is stored in memory. The causes of amnesia may be organic or functional. Organic causes may include brain damage through injury or the use of specific drugs, usually sedative drugs. Amnesia may be one of the symptoms of some degenerative brain diseases, such as Alzheimer's disease. Functional causes are psychological factors, such as defense mechanisms. Our ability to recollect events and experiences is a very complex brain process. Being a little forgetful is completely different to having amnesia. Amnesia refers to a large-scale loss of memories that should not have been forgotten. These may include important milestones in life, memorable events, key people in our lives, and vital facts we have been told or taught. Most people with amnesia are usually lucid and have a sense of self. However, they may experience severe difficulties in learning new information and forming new memories, as well as finding it extremely difficult to recall memories of past experiences and information. There are many different types of amnesia. I will just mention the most common ones. Anterograde amnesia. The patient cannot remember new information. Things that happened recently, information that should be stored in short-term memory, disappear. This is usually caused by brain trauma, brain damage from a blow of the head, for example. However, a patient with anterograde amnesia can remember data and events which happened before the injury. Transient global amnesia, a temporary loss of all memory. The patient with transient global amnesia also finds it very hard to form new memories. He or she has severe anterograde amnesia. The loss of past memories is milder. This is a very rare form of amnesia. A transient global amnesia patient tends to be older and usually has a vascular disease. Traumatic amnesia, memory loss caused by a hard blow to the head. People who lose their memory as the result of a car accident may have traumatic amnesia. People with traumatic amnesia may experience a brief loss of consciousness or even go into a coma. In the majority of cases, the amnesia is temporary. How long it lasts usually depends on how severe the injury is. Sports scientists say that amnesia is an important indicator of concussion. And hysterical amnesia. This is a very rare phenomenon. Patients forget not only their past, but their very identity. A person could wake up and suddenly not have a sense at all of who they are. Even if they look in the mirror, they do not recognize their own reflection. All the details in their wallet, driver's license, credit cards, IDs, are meaningless. This type of amnesia is usually triggered by an event that the person's mind is unable to cope with properly. In most cases, the memory either slowly or suddenly comes back within a few days. However, the memory of the shocking event itself may never come back completely. It is important that doctors diagnosing patients for epilepsy eliminate this type of amnesia from their list of alternative illnesses. Any disease or injury that affects the brain can interfere with the intricacies of memory. Memory function engages many different parts of the brain simultaneously. Damage to brain structures that form the limbic system, the hippocampus, and thalamus can lead to amnesia. The limbic system controls our emotions and memories. Fortunately, in the majority of cases, amnesia resolves itself without treatment. However, if an underlying physical or mental disorder is present, it should be treated if possible. Psychotherapy may sometimes be effective for some patients. Hypnosis can be an effective way of recalling memories that have been forgotten. Family support is crucial in helping a patient with amnesia get better. Psychologists and psychiatrists say that reality orientation aids may help nudge patients back into their environment if they are surrounded by familiar objects, photographs, smells, and sounds. Complications depend on the severity and scope of the amnesia. However, even for people with mild symptoms, difficulties in dealing with daily life can take their toll. Patients can experience employment, school, and social problems. Some individuals never recover lost memories. In very severe cases, people may require some kind of supervision or extended care facility. And these are the different types of amnesia.